Hello, my name is Megan Appling, and this is my Cognitive Linguistics on-call notebook. Several of these activities have come from my skilled nursing facility that I completed in the spring, so I have used a lot of these activities with several residents. The 5 cognitive domains that are included in my notebook are attention, orientation, memory, visual spatial processing, and executive functioning. These activities have been chosen for this on-call notebook because they're culturally, educationally, and economically neutral. They focus on general skills and activities that most people have had experience with, and they can be easily adapted and substituted when not appropriate for a specific client. They can be translated for clients that use a different spoken language, and the cognitive level of the activities vary for clients with varying impairments and cognitive levels. It's always important to get to know each client and adapt activities to their interests, education level, cultural background, and other background factors. For attention, the exam or assessment that I chose was the Moss Attention Rating Scale. I then included some of the goals and strategies that can be used for time pressure and attention training. This grid has wonderful ideas for attention activities in the last column. It also includes memory activities. So for childhood memories, they can put puzzles together that are related to their childhood experiences. For historical information, attention activity would be a state puzzle or a sing-along of songs popular in their teenage years. Oral reading, listen or read for increasing time spans. Overlearned procedures, they could be cleaning tables or sorting silverware, just to make sure they have that attention to detail. Art, adult coloring books, that would, you could increase the level. If they're more of nature sensory, they could paint a birdhouse, plant seeds. Family background, they could make a family tree. And holidays or celebrations, they could make a craft corresponding to the holiday. Other activities that I found, worksheets, would be something like paying attention to a TV schedule and answering questions about it. Or taking the time to plan a calendar and using dates that are given to organize the calendar. Now, this could also be used in orientation, but I included it in my attention section. Other things that could be included are using ads or business cards or messages and answering questions. I also included some rehabilitation strategies. And then for these activities, they must pay attention to the lines and find the given letter and mark them. Or you can also include 2 letters that they need to find for higher level patients. We also included numbers. And then the final activity that I included in my attention section, this is getting the client to copy a small paragraph using the a number system. So it helps them give them that maximum cueing strategy of writing a paragraph or copying words. For my orientation section, I use the Galveston Orientation and Amnesia Test, or GOAT. One of the things I included, some general orientation information, just getting them to write the months of the year or the days of the week, or write the years following 1998 up until now. If the patient can't write for any reason, you can have them say the years or the months or days of the week. Also, having them fill out a calendar and maybe things that are going on at the skilled nursing facility for that month. This would be a good monthly activity for the clients. One of the patients I had was having trouble remembering when his family was coming to visit him. And so we got him a calendar like this, and we had him write down every time they came, or had his family write it down with him. So it helped him with that orientation of what was happening around him, but also that memory aspect of it. These are just some questions for orientation to the immediate environment and what's happening now, such as, what's your full name? What do you like to read? What day of the week is it? What year is it right now? What month are we in? This is orientation to past and present events. So it goes back a little more to that long-term memory. Did the Vietnam War end in 1963? Are some contact lenses considered disposable? This is something I would only give to higher level residents or clients. Here's some more orientation to past and present events. This is a autobiographical orientation page that they can give you this information. You can use it to receive information on the client. You can also have them kind of post it just to help them remember and stay oriented on all of their facts, such as their phone number, the date, where they are, and how they were injured, and things like that. Here's just some strategies for an orientation book to include in their orientation book. This is my first flagged activity for severely impaired clients, because it's the errorless learning protocol. So you would say your name is, and then ask them immediately, what is your name? So it gives them that maximum cueing on the information. This is another spaced retrieval training protocol, but it gives them longer pauses. So it goes from immediate to 15-second delay to 30-second delay. And this discusses the chaining technique. So here's an activity for forward chaining. And here's an activity for backward chaining. For memory, I use the mental status exam, the St. Louis University mental status or SLUMS examination. I used this memory training program as my first activity. It gives some strategies, organizational or storage devices that can be used, some environmental cues that can be used to train the clients, and then some verbal and visual means. The next activity is another memory training activity that I found. My memory is the thing I forget with. So it just talks about all of the different types of memories, and how we process our memories. And then includes some treatment. Other things, some immediate memories that activities that I found were repeating 5-word sentences, where you say the 5-word sentence and then the client immediately repeats it after, and then it can be moved up to 6-word sentences. A little more simple would be a 3-digit sequence. So this uses telephone area codes. Or advanced 3-unit sequences for those higher level clients. And then we move up to 4-unit sequences. Other memory tasks would be naming lists. So asking the client to say their alphabet, or the months of the year, the seasons, the planets. As this goes on, it gets a little more difficult. Baseball positions, of course, the client would have to be familiar with baseball in order to do that one, but it could be adapted to anything that interests them. Gardening supplies. The U.S. presidents, animal classes. As I said, as they go up, they get more high level. This is some more long-term memory. Where did you grow up? Do you have a sibling? And then this is functional memory. You're going to have the client read the memo and then encourage them to reread it, repeat it to themselves a few times. Once they've done that, you cover the memo and ask them questions about the memo. This is for a doctor's appointment, the same procedure. And then we also have an activity on retention of a paragraph. So you would have the client read the paragraph and then ask them the questions once you take the paragraph away. We also have visual spatial processing. For visual spatial processing, we have the Montreal Cognitive Assessment, or the MoCA. Especially this top part, that would be the visual spatial part of it. My second activity for severely cognitive impaired clients would just be a simple matching game. You would ask the client to match the picture to the one that matches on the table. Right now I have a field of 6 laid out. However, for more impaired clients, you could always reduce it to a field of 3 or a field of 2, just depending on their level. And I also have circle the numbers in order as a severely impaired activity. Now, for those severely impaired, I might say the number and just have them find it. So I would say 1 and have them circle the number, and then 2 and have them circle the number. For higher level clients, they can find the numbers in order themselves. These are some items of different sizes, and they would count how many 2s are in the box, or how many circles. But this is more advanced because, of course, it's not as organized, and the items are of different sizes, and just kind of uses that higher level thinking. This is another higher level activity for visual recognition. They would read the clues, and they would cross out the ones that wouldn't work, and their goal is to find which man they're describing. And then this is some spatial awareness, and it just gives them directions. In the upper left box, write the letter R. In the lower right box, draw a circle. In the box next to the circle, write your name. So it's that following directions, but also that spatial awareness, which one is next to the box with the circle, and so on. And then we also have describing pictures or recalling visual details. So in this, I would give the client the pictures that follow, and then ask them questions, get them to answer the questions, answer questions about them, describe them, or make up a story about each picture. The pictures should be printed in color, but they're not currently. The color would add more vivid details for the client, so there's several of these. Then we also have some goals and training strategies. We also have this color copy challenge. So you would give the client markers or color tiles and get them to repeat the design. We also have a maze, just to use that visual planning to kind of decide where they need to go in the maze. And also a Lego pattern. This is for the more tactile group of clients that you have that like to use their hands. So it gives them a design to follow, it gives them what they need to plan out, and then they try to build the school bus or the bats. And this can be adapted for any client's interest, a football helmet, and so on. And then finally we have the executive functioning. For this, I chose the functional assessment of verbal reasoning and executive strategies as the assessment. For this, I have a lot of everyday activities and how can they function using everyday activities. For example, this is just putting the sequence in order to making a dress, or cleaning out the refrigerator. What comes first? Open the refrigerator, close the refrigerator, wash the bins and shelves, throw away old food, and so on. This is the same thing, but for the community. What would you do if you were selling your home, dealing with a car accident? And again, it gives them the steps, but they're putting them in order. Higher level would be getting them to just describe the steps. This is one of my severely cognitive impaired activities, giving just pictures of everyday objects to a client, and getting them to match the function. So if you lay out two and you lay out socks and an egg and you say, which one do you wear on your feet? Or which one keeps your feet warm? Or which one would you eat at breakfast? And they choose the correct object. This is medicine management for executive functioning activity. It's best for higher functioning patients that are probably going to go live on their own. You would give them a list of medications to organize. And of course, you have fake medicine. We use Mardi Gras beads in New Orleans. Just to ensure that the patient will be able to independently take their medication safely. So they would organize it for the week in a pill organizer. This is another severely cognitively impaired patient activity. It's sequencing of very simple activities, and because it's in a puzzle format, it kind of gives them that little bit of help on the sequencing of the activities. And you would also be able to help them by giving them max cueing on the activity. I had a patient with severe dementia, and she was nonverbal, but she loved puzzles. So this was something that kind of helped her hit that sequencing portion of her goal, but also use something that she liked to do. And then we also have sequencing for more higher level clients. They are 4-step. They're more advanced steps. They're not as clearly written out. And these could always be personalized. Take pictures of washing dishes and get them to organize it or something like that. Also, this is a practice for filling out medical information. If they're going to live at home and they're going to be taking care of their own medical history, this is something that would be very important. Functional math, just what's a better deal? 4 rules for $2 or 6 rules for $3. You can also read the scenario. You're going to the grocery store and you have a budget of $40. You need to get toilet paper, chicken, potatoes, loaf of bread, and so on. So what would you get? Which amount? And then you add your groceries together, and if you are over budget, solve your problem by exchanging one higher priced item for a cheaper one. So it really hits on that critical thinking, the budgeting, making sure they'll be able to successfully go to the grocery store themselves. These are some other functional math and writing: balancing a checkbook, writing a check, and addressing an envelope for activities. Getting them to practice writing a check, practicing addressing envelopes, and then safety issues. What should you do if you fall in your basement and think you might have twisted your ankle? Someone hurt you? Just making sure they can assess their safety when they go home or in the nursing home, wherever they're going after you see them. And then some functional skills: cooking a meal. Describe all of the steps needed in order to prepare the following items. A can of soup. It's nothing that is very elaborate, just simple things that they might be doing when they're going home. A TV dinner, a bowl of cereal with bananas, fruit salad, so on. Daily skills that people need to do when they're at home: doing the laundry, raking the leaves. It asks simple questions. What supplies are you going to need? Where do people wash their clothes? What are the steps you need to do? And finally, I have 5 articles that I found for preventing cognitive decline. This is preventing cognitive decline in healthy older adults. Then we move on to: does physical activity prevent cognitive decline and dementia? A systematic review and meta-analysis of longitudinal studies. The third is nutrition and mild cognitive impairment, food for thought. Fourth, sending your grandparents to university increases cognitive reserve, the Transmanian Healthy Brain Project. And finally, my 5th article is strategies for dementia prevention, latest evidence and implications. Thank you for your time, and I hope you enjoyed my on-call notebook.